Hello, hello, welcome back to the top 100. Let's get started with drugs 71 through 80. All right, so up first we have brand name Seroquel, generic quetiapine. This is used for schizophrenia. It is a dopamine and serotonin receptor blocker. And now this is going to look a little foreign to you, but you'll still see this now and then. I want to at least give you an overview of what this means. Hepatic cytochrome P453A4. That's the abbreviation, CYP3A4. That particular enzyme, when blocked, wreaks all kinds of havoc on drugs that are metabolized through this pathway. So cytochrome P450, that's the pathway. And there are so many interactions that there's actual tables. You can look it up. And this is one of those that will be subjected to a drug interaction if another drug is also is metabolized by the same pathway. Okay, just wanted to show you that much. Sedation causes, a person to feel tired, and increased mortality in elderly with dementia-related psychosis. I'll tell you about that in just a minute. It's frequently used off-label for a lot of things, and primarily insomnia. I see this every day. Doctors just prescribe it for sleep in patients with psychiatric disorders. The FDA has not approved it for that, but doctors do it anyway. All right, so the boxed warning is increased mortality in the elderly. So mortality is dying, and elderly patients with dementia-related psychoses. So a patient who has some sort of dementia, some like mind deterioration, those patients are more likely to pass away, and they believe it's attributed to Seroquel. So it's really not a great drug for the elderly with dementia. Not at all. They shouldn't be getting this drug to help them sleep. It also can increase suicidal thoughts and behaviors. All right. Next we have ergocalciferol, which is a form of vitamin D. In fact, it's vitamin D2. All right. So obviously it's used for vitamin D deficiency, which you can only find out if you have blood work drawn. It promotes, what vitamin D does actually, it promotes calcium and phosphate absorption, which are critical, chemicals and minerals that you need to have in your body and in normal levels. And if your vitamin D is low, you won't absorb calcium and phosphate as well. And that can lead to other problems like brittle bones and things like that. So it is a fat-soluble vitamin. Why am I telling you this? Because you need to memorize this. There are only 4, A, D, E, and K. Memorize that. Fat-soluble vitamins can build up in the body. Okay, they can store, got lots of fat. And other vitamins, for example, there are some you can overdose on, but for the most part, if you take too many, you pee them out. Your body just, they just go into your GI and out they go. Not so with fat-soluble vitamins. So in theory, you can overdose on all of them. And some it can be really bad, like K, it can be really bad. A, if you, there's so much vitamin A in a polar bear liver. Now, I don't eat liver from any animal, but if I was to eat a polar bear liver, I would die from so much vitamin A that is in that liver. Thought you wanted to know that. So, okay, so it's very convenient because it's fat soluble that we can actually only have to take it once a week. So they do an ultra high dose. Usually it's 50,000 IU. International units, because we don't express this in milligrams. We can convert it, but in some bottles over the counter will give you that strength, but it's not necessary. And it's also better absorbed, you guessed it, with a fatty meal. So if you're having Sunday dinner every week, that's a great time to take it with a big steak, turkey meal, whatever. All right, so yes, you can actually have vitamin D toxicity with excessive dosing. So I never recommend anybody take any supplements other than a multivitamin unless they have blood work drawn, because all vitamins, like magnesium, for example, can cause heart problems. So patients read or see something in the news like, this medication is great for this. This vitamin is good for this. And then they come to the counter at the pharmacy and they start buying all this stuff. And I'm like, they ask me if is this good for leg cramps? I'm like, well, if you're deficient in that vitamin, then it would probably work and help your leg cramps. Do you know if you're deficient? And the answer is they have no idea. So we tell them to call the doctor's office. All right, so this is plant-derived, and which is very interesting. The other vitamin D is D3, and this is something you should know. Write this down on your special notes. D3 is more absorbable. It's actually animal-derived, so not everybody's going to want that, but it is the higher bioavailable form. Let's move on. Next, we have brand name Catapress, and generic is clonidine. FDA has approved this for blood pressure and also for ADHD. However, off-label, there are about 24 more things this has been prescribed for. Now, when I used to work at the hospital, we had a protocol for clonidine for patients who came in to detox from whatever substance. Usually it was alcohol that we saw the most of. And they would stay in for a week, and every day would get some clonidine, and tapering amounts, actually, because the side effect is lowering of your blood pressure plus sedation. So, but it really helps with withdrawal, helps with Tourette's syndrome, hot flashes, helps people to sleep, and anxiety, and lots of other things. What it does is it causes a decrease in norepinephrine, and epinephrine, norepinephrine, that is the fight or flight reflex that we have, right? It makes you nervous. Like even I think this helps with PTSD. So decreasing that is gonna remove your fight or flight, response. So next up is Spiriva Handihaler. This is a special inhaler that is not under pressure. It's not an aerosol. Generic name is tiotropium. And I'll tell you about the inhaler in one moment itself, but it's basically anticholinergic, and it prevents bronchospasms in COPD, which is chronic obstructive pulmonary disorder. It is not an aerosol, so it's an inhaler that's in a powder form. And when you like, this one actually it's like a clamshell. You open it up and you take a little capsule. Looks exactly like a capsule. Looks like a cephalexin, as a matter of fact. And you put it into the little clamshell part, and then when you close it, it cracks, and the powder falls into the chamber, and now the patient can inhale it. And they actually need to inhale it 2 times. They're not going to get any more than is in there, but that way they get all of it. Inhale, hold 10 seconds. It is not going to work right away. It's not a rescue inhaler. This is for maintenance only. It can take about 30 minutes to 3 hours for the full effect, and they need to do it once a day. I said it was anticholinergic. Do you remember me talking about anti-SLUD? You remember? Salivation, lacrimation, urination, defecation. Okay, those are all watery things. If it's anti-SLUD, then it's anti all those things. Okay, so that's why it can affect eyes for a patient that has narrow angle glaucoma, and can cause urinary retention because we're drying things up. If something is anticholinergic, it's anti-SLUD, anti-watery stuff. All right, so I want you to know that because certain patients cannot have this for that reason. Would this be a good thing for a patient with prostate disorder, a benign prostate hypertrophy, as an enlarged prostate, BPH? No, because it's going to cause urinary retention. So that will cause it to back up behind the prostate and become more painful. So no. Okay, let's move on. Now, the brand name on this one, I thought I would show you. This medication is identical, except one is a tablet and one is a capsule. It contains 2 medications in each pill. Okay, it's a combo medication. So Maxide has triamterene hydrochlorothiazide, and Diazide has triamterene hydrochlorothiazide. The difference, one's a tablet, one's a capsule. I don't know why. I don't know why they did this. So because there's a diuretic in there, it reduces fluid, and the triamterene is also a diuretic. Why are there 2 diuretics in here? Here's why. So we talked earlier about potassium with these diuretics, right? when you're having hydrochlorothiazide, you might have to eat a banana every day because it gets rid of the potassium. Well, triamterene is potassium sparing, and it doesn't do that. It actually causes you to hold on to your potassium. So someone had the bright idea of putting these two together, and maybe potassium levels won't be affected very much. So that's the idea. All right. So triamterene is potassium sparing, and it doesn't lower potassium. Potassium is K+. And hydrochlorothiazide can deplete potassium. All right. Now, you also already know about hydrochlorothiazide because it's on your list. Go back to number 11. All right. Next up, we have Claritin. This is a second generation antihistamine and is available over the counter. Now, first generation antihistamines are going to be Benadryl, which is diphenhydramine, chlorpheniramine, and if you did the pronunciation assignment with me, I kind of grouped them together so that you can kind of get a rhythm. Chlorpheniramine, diphenhydramine, brompheniramine. I don't know if that was on there, but you can hear the ending. They resemble each other. Those are the first generation. This is second. Second generation is loratadine, fexofenadine, cetirizine, desloratadine, which is loratadine isomer, and levocetirizine, which is the same thing as cetirizine with a levo in front, another isomer. Anyway, why am I telling you this? Because they have much better side effect profile than the first generation. Usually that's the case with first, second generations. Always an improvement. Okay, so hives, this is what you're going to be treating. Hives, runny nose, watery eyes. So antihistamines actually follow the SLUD, the anti-SLUD. They follow the SLUD effects. So, so runny nose. Okay, so if you take an antihistamine, it's going to be anti-SLUD. So it's going to dry the runny nose. If you take an antihistamine as anti-SLUD, it's going to dry the watery eyes, which is anti-lacrimation. Okay, so antihistamine, anti-SLUD kind of has anticholinergic effects. Easy way to remember it that way. And it lasts for 24 hours. Way better than diphenhydramine, which causes lots of sedation and causes, you have to take it every 6 hours. Okay, so this is 24 hours. And same profile as fexofenadine. So what you can do on your keyboard, you hit Control, hold it down, F. Type in fexofenadine and go find that one. And again, this is over the counter. And if fexofenadine isn't on the top 100 anymore, put it in there. Same profile, second generation, and all those same profiles. Non-sedating. Cetirizine is though. Okay, so Elavil 25 milligrams. This is generic. The generic for this is called amitriptyline, and it is the drug class of tricyclic antidepressants. That is abbreviated as TCA. There are many other uses for this medication. Neuropathy is one of them. We use this a lot in an elderly patient who has their extremities are fingertips. We might use it in a diabetic also. Fingertips, toes are just feeling numb. So, and so because it causes drowsiness, doctor can kind of get two uses out of it. It also has anticholinergic effects, anti-SLUD effects, so it can help with bedwetting. And they do a low dose in children. I want to tell you, this has a 10 milligram available and 100 milligram. And I have seen them get mixed up. So we always have to slow down and double check all our zeros, all our decimal points. All right, so very similar profile to nortriptyline, okay? Amitriptyline, nortriptyline. Sound a lot alike because they are a lot alike. They're both tricyclic antidepressants. All right, and the box warning, as it is with all our antidepressants, there is an increased risk in suicide with teens and young adults. So if there's a worsening of symptoms, it's very critical that we get that patient in to be seen. They shouldn't stop suddenly taking it either. So you can't get that kind of advice out. You can't. That's up to the provider. All right, what is next? Next is folic acid. No picture. Sorry. Folic acid is a vitamin. It also goes by the name folate. It can be used as interchangeably. I don't have a brand name for this. It is a vitamin that aids in preventing anemia. It's over the counter and prescription. Now, over the counter, it can be 400 to 800 micrograms. Now, take the little decimal point. That's at the end of 400. Okay, let's move it to the left 3 times. 1, 2, 3, 0.4. That would be 0.4 milligrams. 0.4 milligrams, same thing. Okay, or you could go this direction. 1, 2, 3, and you have 800 micrograms, or 0.8 milligrams. Same thing. You're going to see it expressed as folic acid 400 micrograms, or maybe folate 0.8 milligrams. All right, prescription 1 milligram. Can't get that over the counter in that strength. All right, so there are drugs that will decrease folic acid levels. So often when a patient is taking methotrexate, they also get a prescription for 1 milligram folic acid. Now, on a separate issue, pregnancy, low levels of folic acid during pregnancy can actually cause birth defects. Specifically, the vertebrae it's supposed to close around the the spinal canal is supposed to close around the vertebrae, and if you don't have enough folic acid, that doesn't happen for the baby, and then they're born with a birth defect, and they'll be permanently handicapped for the rest of their life. So so that's really important. It happens as early as 3 to 4 weeks into the pregnancy. So if a patient's trying to get pregnant, this is why we put them on we put them on a prenatal vitamin before they even get pregnant. And everyone can take a multivitamin, even if they're, not trying to get pregnant, but they think they might in the future, just to keep the levels normal. Also, orange juice is pretty high in folic acid, so just good information to know and good education. Next, we have Topamax. We just got 2 more, okay? Topamax is, they changed the colors, Topmax. The brand name, that's their style, but it is spelling of one word. 100 milligrams in this bottle here. Comes in 50, comes in 25 milligrams as well. Generic name is topiramate. Used for seizures and also for migraine prevention. All right, so there's over a dozen off-label uses for this as well. And from withdrawals to pain, treating bipolar and binge eating disorders, PTSD. So it's kind of in that regard, kind of very similar to clonidine. It can cause memory problems, and it also can cause birth defects. So if a patient's taking it for seizures, it's really a delicate thing if a patient wants to get pregnant if they're epileptic. So they really have to see the right doctor for that. All right, now we have our last slide. We are at, and we're actually going to beat this one in 20 minutes. Less than 20 minutes. Aldactone 25 milligram. This is the brand name for spironolactone. It is a potassium-sparing diuretic. That's what you need to know. And it can cause hyperkalemia, like that triamterene. Okay, when it's potassium-sparing, it holds the potassium. And if this is combined with lisinopril or something else like losartan that also increase potassium, then we need to have their labs checked regularly to make sure their potassium doesn't go too high. Because if it does, they're going to have palpitations or worse. Okay, so monitor the potassium. And what is it used for? It's a diuretic. So it can be used for fluid and can be used for hypertension. Fluid, another name for fluid, as we should know by now, is edema. Okay, off-label, this is used for acne. Okay, so that's all I have for now. And I appreciate you sticking with me through this one, and I will see you in the next movie.